coming again, and sorry we're a little bit late, but hopefully things will run smoothly. So I'm Melissa Schweiger-Kleinman, the Director of Communications here at Schweiger Dermatology Group, and I'm here with Dr. Brian Hibler in our penthouse office in Midtown Manhattan, where he practices. He's been seeing patients here since 2021. He comes to us from Harvard Medical School, where he completed his cosmetic dermatology training. He did a fellowship at the Wellman Center for Photomedicine, which is one of the leading laser and cosmetic centers in the world. And he uses lasers, injectables, and all sorts of other fun devices to make his patients give them an ageless, beautiful, natural look. So we'll start by asking, for those of us who've never done cosmetic procedures before, how should we approach this, and how should we approach aesthetics?
So when I think about cosmetic dermatology, cosmetic procedures, I think about maintaining that youthful appearance. And what we've seen over the last few years is that the pendulum is swinging back. Before, patients were doing a lot of these treatments, a lot of Botox and filler, and almost creating an unnatural look. They weren't aging gracefully. And now that pendulum's swinging back and we're doing less aggressive treatments and kind of staggering them out and spacing them out so that globally you get a refreshed, rejuvenated look. And that's been my approach to cosmetic medicine, is that you come up with a plan. You start off with what bothers the patient the most when they look in the mirror. You know, is it the brown spots, the sun damage, is it a line or a wrinkle? We start there, but then we also craft a plan and tie in a lot of the topical treatments that we have. So it's a combination of both topical medicines and procedures, and space them out over time to give them a real refreshed, natural look.
Got it. What is your approach to aesthetic treatments?
So my approach is to start with the consultation with the patient, see what do they see when they look in the mirror, what catches their eye. And we have so many new treatments that are available in the clinic here, between lasers and body contouring devices, injectables to relax the wrinkles, and injectable fillers to address more volume loss and folds. So we've got so many tools in the toolbox. What I like to do is talk to the patient about what's bothering them, come up with a plan to address that, but then I also offer other strategies for overall rejuvenation, and it's really a combination approach that gives you the best results and keeps it looking real natural.
And what age do you suggest starting? I know the buzzword Prejuvenation has been, brought up a lot, but what does that mean exactly?
So I get asked this a lot. How early is too early, or how young is too young? Practicing in this location in Midtown Manhattan, I do have a lot of younger patients coming in, and everyone ages differently. I've got a lot of young, fit patients who have lost a lot of volume in the face. They're losing some of that baby fat, and the fat pads are starting to descend, so they're losing that volume in the cheeks. I've got other patients like this one here who, even though they don't have the lines and wrinkles at rest, they have strong muscles that are capable of crunching and forming those lines on the forehead and between the eyes and around the eyes. And so for a patient like that, you'd want to use one of our neuromodulators to relax that muscle crunching and over time prevent those lines from setting in. And that's that concept of prejuvenation. So it's really a preventative approach rather than a corrective approach. And it's by spacing out these treatments, doing less aggressive treatments, but doing them a little more frequently and over a longer period of time, that mitigates the need for doing something that's really aggressive down the road that has higher risk of complication, more downtime, something more reparative. We're shifting away from that. We're doing less aggressive treatments, but starting a little earlier and doing them a little bit, spacing them out.
So is there an age, somebody actually wrote in, is there an age that's too young for Botox?
I've got a lot of patients in their 20s who have a lot of muscle movement. They've got strong muscles, and over time it's going to start to settle in, and they're going to form static lines, which are lines at rest. So even if a patient's in their 20s, if they've got a lot of muscle movement and we want to contour the brow, if we want to give them a nice relaxed, refreshed look, I think those are great candidates for neuromodulator treatments such as Botox. We can also use it in other areas as well. So if a patient doesn't want to do filler in the lip, but we want to try to evert the lip a little bit, called a lip flip, we can use Botox or a neuromodulator there. We can also use it in the masseters for patients who clench and they've got bulky muscles. They're the masseters, and we can do it to shape the lower half of the face. So here we've got a video of a patient getting Botox to the masseters. So what's nice is we've got a lot of different tools, and we've got a lot of different places that we can apply them to really customize the treatment to the patient. And so I do have a lot of patients starting early.
And so what's the difference between filler and Botox?
So I get this a lot. Patients will come in and they'll say, oh, I need, Botox here and here and here and here. There's a little bit of a difference. And the easiest way to explain it is that Botox or the neuromodulators relax muscle movement. So the lines that are formed by crunching of the muscles, such as between the eyes or above on the forehead, around the eyes, those are caused by muscles crunching. So that's where you use Botox or a neuromodulator. If patients have volume loss, so they're noting that the fat pads are coming down and they don't have the nice cheekbones that they used to, or they want a little bit more fullness in the lips, a little more volume, that's when you use a filler for those locations.
Okay, got it. So I know injectables are just one treatment you use in your toolbox, and I know you've done extensive training with lasers. So can you tell us a little bit about laser treatments and how they help rejuvenate skin?
So we've got a lot of different lasers available to us, and that's what makes this so much fun. We have lasers that target broken blood vessels or anything that's red that has hemoglobin. We can target that. So whether it's a broken blood vessel, broken capillary, spider veins, red scars, red stretch marks, anything that's red, we can target with that vascular laser. Then we've got other ones that target pigment. So sunspots, or even the pigment in the hair, which allows us to do laser hair removal, we can target with the laser. We can treat tattoos to remove those as well. And then we have other lasers that are for resurfacing, so for the texture and tone of the skin, for acne scars, for wrinkles. And what we can do is we can kind of craft a plan that a lot of times patients will come in with acne scars that they have atrophic or depressed acne scars, but they also have ones that are red, and they may also have a little bit of background sun damage. We can combine multiple lasers at one visit to address all of those concerns, and at this particular location we've got all of the toys to play with, which is just wonderful.
Right, and I've heard that sometimes there are some medical benefits to these laser treatments as well. Can you talk a little bit about that?
Yeah, so some of these lasers do have medical benefits as well. One of the most popular lasers, which we see here in the video, is the Fraxel laser, which is a fractional non-ablative laser used for resurfacing and to erase sun damage. It's actually FDA approved for the treatment of actinic keratoses, which are pre-cancerous growths on the skin. And while it's unfortunately not covered by insurance, it is a nice option for a patient that wants to get both a medical and a cosmetic benefit. And I just wrapped up a study that will be published soon where we found that patients who had this treatment, as compared to patients who didn't have this treatment, had fewer facial skin cancers in the years after having this treatment done. It needs a little bit more investigation, but to me this is early evidence that although these treatments are being done for a cosmetic benefit, if it can prevent a skin cancer down the road, to me that's a home run. When you have a treatment that has both a medical and a cosmetic benefit, right, that's a winner in my book.
That's exciting.
Yeah.
It's definitely an excuse to come in and get a laser treatment.
Even more reason to, absolutely.
Okay, let's talk about the lower half of the face, which typically in the past was only really treatable by surgery, but now there's things that we can do. What are those things?
So the lower half of the face, we're seeing more and more patients, whether it's a little spillover from the Zoom effect, where patients were really focusing on the upper half of the body and really the neck up. Patients, after they start to address their facial cosmetic concerns, are noticing the laxity in the neck, the horizontal lines, a little bit of fullness under the chin. We've got a lot of different options. We have injectables such as Kybella to reduce some of the fat under the chin, or we can use a device called True Sculpt, which uses radio frequency and heat, or Cool Sculpt, which uses cold, to melt away some of that fat. And that's really important because the jawline really delineates the face from the neck, and you really want to have a strong contoured jawline. In here we've got a video of one of the other treatments that's good for early laxity, which is the soft wave treatment, which uses ultrasound to develop and stimulate new collagen formation. So this gives a little bit of tightening for lax tissue. We can use it around the jawline to sort of tighten things without the use of filler. And I really like it for on the neck, for a little bit of that laxity and some of those horizontal lines. It just tightens. It does take a few months to see the improvement, but and I've got a lot of patients that have had that and they've been very satisfied with that as well.
Yes, well, I'm definitely one of those patients. So let's talk about how often people should be coming in for cosmetic treatments.
So each of these treatments has a different sort of duration. The most popular procedure across the board is the injectable neuromodulators such as Botox or Jeuveau. Those typically last about 3 to 4 months on average. Some of the dermal fillers last around 9 months to a year, and others last as long as a year and a half. And then the laser treatments, depending upon what you're getting done, but let's just say you're doing something for overall rejuvenation, patients may come in every 1 to 2 years to do that and kind of touch it up. And what's a good time is when patients come in for their annual skin check. Then we also sometimes can do one of these treatments at that same visit. If we know sort of in advance, we can address both the medical concerns, do the medical dermatology, and do something to kind of give a little refresh to the appearance at that same time. So the annual skin check's a nice point when patients can sort of check in and discuss some of these cosmetic concerns.
Little multitasking.
Exactly. Yeah, kill two birds with one stone. Exactly. Get it all done in one visit.
Okay, so what makes cosmetic dermatology different than surgery?
So cosmetic dermatology really focuses on the use of non-invasive or minimally invasive treatments. And while it doesn't provide the same results as surgery, I've got a lot of patients who don't want to have surgery and have scars.
Right.
But if they're starting to do these treatments earlier and they want to address a little bit of laxity in the lower half of the face, a little bit of laxity in the neck, and they're not ready or they don't need surgery yet, we have non-invasive methods or minimally invasive methods to restore volume, to provide contouring, to reduce fat. And so these treatments are wonderful because we can address things both on the face and the rest of the body in a minimally invasive or non-invasive fashion with little to no downtime.
Got it. So one of those things is body contouring. Can you talk a little bit about the body contouring treatments that you perform?
So we've got a few different things here for body contouring. One of the most popular is cool sculpting, which is selective removal of fat by using cold. And the most popular locations are on the abdomen and the flanks, but we can also do it on the upper arms, the thighs, underneath the chin. We've also got another device that uses radio frequency called the True Sculpt. That's another option for fat reduction, non-invasive. Again, cool sculpting is also completely non-invasive. We've got muscle toning devices such as the M-Sculpt that helps tone the abdomen, the buttocks, the thighs. We've got a lot of great tools, and it's very exciting because we're finding all these different ways that we can combine them and use them to just enhance someone's different features, and it really augments the work that they're doing in the gym. So patients who are at or near their goal body weight or are on that road to kind of getting in ideal shape, we can kind of use these treatments to augment the work that they're doing in the gym. And sometimes, despite no matter how much you're doing with diet and exercise, you might still have these stubborn little pockets of fat, whether it's underneath the chin or on the lower abdomen. Those are the most popular locations that patients come in, just to touch things up and kind of refine it.
Got it. So maybe a prime candidate for body contouring is somebody who's looking to really target those areas?
Yeah, really targeting focal pockets of fat. These aren't meant for weight loss, these treatments. They're really for just contouring and shaping certain areas. And patients love it because they've been used for a long period of time. They're used in multiple different places on the body and in completely non-invasive fashion. So
right.
It does take a few months to see the full results of the treatment. So you can't come in today and see the results next week. So you got to plan in advance, and sometimes patients might need a second treatment. But again, the fact that we've got these treatments in a completely non-invasive fashion is really exciting.
So you mentioned things that take a while. What about something that shows immediate results? The holidays are coming up. If you want a little makeover before your party season starts, what should we do?
So for patients that are looking for a little refresh, one of the most popular treatments is a neuromodulator or wrinkle relaxing injectable. This takes about 2 weeks to see the peak effect, so within a few days you'll already notice softening of those lines. Gives you just a little more refreshed appearance, prevents you from scowling too much at the holiday dinner so you don't get those angry lines forming there. Some other treatments that are very popular are a light laser treatment or chemical peel. One of the lasers, like the Clear and Brilliant, for example, has very little downtime, just a few days, and you get a nice refreshed tone, a little bit of a glow to the skin, erases a little bit of sun damage and some brown spots. And then dermal fillers. Fillers, you get an immediate lifting, an immediate result, which is really nice. You can get a bruise with any of these injectables, so I wouldn't do it the night before a big party or an event, but as long as you have a couple days just in case there's a little bit of swelling or bruising, that's something else you can do. So patients are coming in getting a little bit of lip filler, a little bit underneath the eyes, a little under the cheeks, and it's an immediate result. So a couple options if you wanted a quick fix.
Yeah, definitely. Okay, so before we take questions that our viewers sent in, what is the difference? I know there's so many med spas that have popped up. What's the difference between coming to see you, a dermatologist, in a medical setting versus going to one of these med spas?
So there's certain treatments and devices that we have in the clinic that we're able to use that they don't have in the medical spa setting. I do all of the procedures myself, so if you come to see me, I'm going to be the one physically performing all of my treatments. I don't have anything delegated to somebody else. We have over 25 lasers and body contouring devices here in our office, so we're really able to customize and tailor the treatments to your particular concerns. And we've got devices that are safe for all skin types, and so really it comes down to safety. Patient safety is paramount. When you're doing an elective cosmetic procedure, you want to make sure that you're in good hands to minimize any sort of risk of an adverse outcome and to heighten your chances of having a good result that you're happy with.
Yep.
And so I think that that's one of the key benefits by seeing a board-certified dermatologist and getting one of these treatments done. And then oftentimes patients are coming in and they want to treat pigment and brown spots, and some of these things are medical issues. And so when you come and see a dermatologist, you're able to address the medical component as well, get prescription treatments if necessary to help complement what you're doing in terms of the cosmetic treatments. And so you get both the medical and cosmetic folded into one visit. So for me, I think these are all important factors to consider when you're choosing whether to go to a medical spa or a dermatologist.
Yeah, that makes a lot of sense. Okay, so I know we had a bunch of you send in questions. Thank you for that. So Dr. Hibler, do you want to?
Sure, we'll run through a few of the questions that we received ahead of time. So we had a few patients participants ask about lasers for broken capillaries, and someone was interested in the pulse dye laser, also known as the V-beam laser. Who's a good candidate and what's the downtime? So we've got a few different lasers on site that are good for broken blood vessels, and these lasers target hemoglobin, which is in the blood vessel, heats it up to seal it off. The most popular laser is the V-beam or pulse dye laser, and for general background redness, when we treat that, you get a little bit of redness and swelling, which can last a day or two, maybe a little longer, depending upon how aggressive of a treatment we need. And for individual broken capillaries or little broken blood vessels, we may need to do little higher settings that causes a small bruise. Mm-hmm. And you can cover it up with makeup, but typically for these vascular lasers, it's just a few days of downtime. Again, some patients get a little more swelling, a little more redness than others, but anyone who's got a broken blood vessel, broken capillaries, spider veins, red scars, red stretch marks, anything red with blood vessels is a good candidate for this treatment. We had a couple participants ask about acne scarring treatments and advances. What are the best treatment options? And I want to get rid of acne scars. I've got indentations on both sides. What procedures work best? I love treating acne scarring because you can really change someone's life with treating acne scars. You can restore that confidence and the stigma associated with acne scars. The challenge is, despite all of our advances, it does take some commitment because it's not a one and done treatment, no matter which tools we have. But we do have a combination of lasers that we use, as well as doing techniques such as subcision, which is breaking up the scar from underneath it, and using other lasers that can target residual pigmentation or redness, and we can combine them and fold them in and do, as I said before, multiple lasers at one visit to try to get you the most improvement. And so, it really depends upon the type of acne scar, whether it's how deep it is, if it's rolling, if some patients have hypertrophic scars or raised scars. We've got a combination approach. So if your concern is acne scars, I love treating acne scars. We've got a lot of tools here, but that really is pretty individualized when it comes to what treatment is the best.
Right. I mean, that's great.
Someone wrote in asking, what's the easiest, fastest, least downtime and pain, not cost-prohibitive way to achieve a more youthful appearance? So that's the holy grail, I think, if we can figure that out. We've got a lot of treatment options, and it comes down to the patient. If a patient has a lot of lines on the top of the forehead or angry lines between the eyes, neuromodulators are a home run. Granted, they do only last about 3 to 4 months on average, but it kicks in within 2 weeks. It's safe, it's minimally invasive, and patients are invariably happy with that. It gives them a nice, refreshed, relaxed appearance. We've got other lasers that target sunspots, and sometimes patients get so focused on the lines and folds and volume, and they don't look at the mottled appearance from the reds and browns with the sun damage. And so by using one of those lasers I just mentioned before, one of those vascular lasers and a pigment laser, we can improve the quality and tone of the skin, and it really takes years off of their appearance. And that can be done in a fashion that doesn't require a lot of downtime. We do have a lot of options. If patients do need something more aggressive, they do have more downtime, obviously we can do a more aggressive treatment. But if we're focusing on things just to give a more refreshed appearance, improve the texture and tone, we do have a lot of different tools for that. I think the best approach is really to start with those high yield treatments that have little downtime, and then you can kind of see how you do with that, and then go to one of the more aggressive treatments if you need to down the road. I think that's the best way to do it.
Baby steps.
Baby steps. And then also developing a good topical regimen too is important, because again, if you don't need a cosmetic treatment, if we don't have to do any lasers, that's the best case scenario. If you can prevent that sun damage from setting in, and you can use some topicals to erase a lot of that sun damage, I think that's the best. But sometimes we do need to combine that with the procedures, with the lasers as well. Someone wrote in asking that they've got very dry, aging skin. What skin routine should I follow? So this is a nice segue to that. If your concern is just dry skin, I think the most important thing is an antioxidant in the morning along with a sunscreen moisturizer to prevent sun damage. At night, you may wish to use a little bit of a thicker moisturizing cream, and maybe even a dedicated eye cream and neck cream that are going to be free of any preservatives or irritants, that are very gentle on the skin. If you've got very dry skin, maybe you're going to want to avoid using a topical retinoid, although in general I'm a big fan of topical retinoids. I think they do have a lot of benefits for the skin, but if patients are very dry, if they've got rosacea and they're prone to dryness, maybe we don't start with that. I consider the antioxidant, sunscreen, moisturizer, and in general a retinoid and moisturizer at night to be my core sort of foundational topical regimen. But then it depends upon the patient once again. Do they have redness and broken blood vessels? Do they have brown spots? Then we can bring in some of the brightening agents and different topicals and serums. So we can craft a customized topical skincare routine as well, but just at the very core foundation, lots of moisturizer, and even putting it on right before bed is really important.
When you say antioxidant, what does that mean? Like, what ingredients for that?
So there's a few different key antioxidants that I look for. One is niacinamide, which is a brightening agent, and an antioxidant combats some of the damage that the ultraviolet radiation is doing at the DNA level. So it increases the repair enzymes to undo some of that damage. Niacinamide is a great agent that's antioxidant and brightening, so it's good for brown spots.
Okay.
Vitamin C and vitamin E are other very potent antioxidants that also have a brightening effect on the skin. And vitamin E is also a little more moisturizing, so if you've got dry skin, maybe that's another good one to look for. And so a lot of the very common serums and antioxidant creams will contain one of these key ingredients, and I think that's important to use, again, to kind of combat that sun damage throughout the day.
Right.
I think we just have time for maybe one or two more of these, but we had a patient or participant ask how to handle small white bumps on the face. I'm assuming they're referring to milia, which are little small cysts that occur. They're little balls of keratin that are underneath the skin. They commonly occur on the eye and on the eyelids. Those can be a challenge. Some patients are just prone to these. I find that a topical retinoid is helpful because the retinoids turn over the skin, giving you a nice fresh layer to prevent those little keratin cysts from getting sort of trapped and stuck under the skin. Right. You can also get a facial or get extractions of those too, and then if you start using the topical retinoid, prevent more of those from setting in. Thankfully, you don't need any lasers or injectables to get rid of those. I would say a topical retinoid and maybe a facial or some extractions. And the last question that I had here was, what about spa treatments for brown skin with melasma and hyperpigmentation? And someone else said, what treatment do you think has the biggest impact on hyperpigmentation? Hyperpigmentation and melasma is very tricky because any sun that you get, if you're prone to this, will trigger it. So strict photoprotection is really important. Using a broad spectrum sunscreen every day, even when it's cloudy, because some of the ultraviolet rays get through the clouds. And wearing hats and using a lot of photoprotection when you're outside, because a single day of intense sunlight can cause it to come out. I typically start with topical therapies because it's a safe long-term strategy to address hyperpigmentation and brown spots. And we do have some chemical peels here that we'll use. When it comes to lasers for hyperpigmentation, they can be performed, but you have to be very careful because the heat and energy of the laser can trigger hyperpigmentation. So it's important to see someone that has experience in treating hyperpigmentation because counterintuitively, even though the laser is meant for brown spots and discoloration, it can trigger it and make it even worse. So you gotta be very careful with laser treatments for hyperpigmentation.
Good to know. That's why you come to a dermatologist
and we come up with a plan. Start with the topical, start with things that are simple and safe, and make a long-term strategy. And then if you do need to do one of those procedures, we do have a lot of different options here.
Good to know. So before we sign off, I know that you just recently started offering virtual consults. You obviously do in-office consultations. What does that process look like?
So when a patient comes in for a consultation, we start by taking a thorough medical history. We review any medications you're on and some pertinent questions relevant to some of the treatments that we might be looking at performing. And I always start with asking the patient by what bothers them, and I hand them the mirror and we take a look together, and then we talk about the strategies. And sometimes patients, for whatever their preference is, they want to avoid certain treatments, they want to avoid injections.
Right.
We talk about all of the options, and we kind of talk about the downtime with each, how many treatments it might take, how much does it cost, what to expect, what are the side effects, and we craft a plan. And so it's not just looking at that one visit. Sometimes patients come in and they know what they want and we just do it. But oftentimes I like coming up with a plan because I develop really strong relationships with my patients, and hopefully they're going to come and see me for a long time. And so I want to kind of lay out a roadmap, kind of what would I envision. And I don't like doing a lot of treatments at one visit. I like spacing it out because then you can really evaluate and see what worked for you, what didn't work for you, what was the downtime like. And sometimes that's a little bit complicated if you're doing a ton of things at one visit. If you've got the time, I think it's better to kind of space things out and do things gradually, and that lessens the chances that you're going to end up doing too much, that you're going to look unnatural. I always start slow, bring patients back in a few weeks, and kind of build from there. And now we have the virtual cosmetic consultation, so that's another option. If you wanted to have a consultation before coming to the office here, we can do it virtually, and it really works well. It uses our patient communication portal, and we're able to have a video conversation. And oftentimes patients are able to show me their concerns. We're able to talk about the different tools that we have here, and we can actually allocate the resources and lasers, so when you come to the office we can treat you that same day if we just know in advance what we're going to be doing. There are some times that patients come in for certain things that they want to talk about, cellulite or the acne scars, and maybe it's something that I do need to see in the office just to really see with fine detail kind of what we're working with. But for a lot of cosmetic concerns, talking about fillers and neuromodulators and lasers, there's a lot of things that we can discuss virtually, and so it saves you a trip to the office, and then you can come in and we just get it all done when you're there, and then we talk in person if we need to talk a little bit more.
Right, come in ready to go.
Come in ready to go. That's the way to do it. Yeah.
All right, well, I think that was all we had for tonight. Thank you, everyone, for joining us, and we hope to see you in the office soon.
Thank you.